Space surgery was pioneered by Dr. Yaroshenko in 1967 with his work in rodents at the Russian Space Agency, aka the Russian NASA. So let's say we make our surgical incision in the microgravity environment within a sterile surgical chamber in the International Space Station. Arterial and venous bleeding in space is less chaotic than on Earth and appears to form domes around the bleeding vessels due to surface tension. This blood must be suctioned away and the bleeding stopped by ligating or cauterizing the vessels. Meanwhile, the internal organs like intestines must somehow be stopped from floating out and escaping the body. The surgical instruments must constantly be held onto or attached to stable objects to avoid them drifting off. Perfect apposition of wound edges in space may be more important than ever, as wounds are known to heal slower in space, and microgravity is known to increase the risk of scarring. But what if there is a surgical emergency in space and not enough time to get a surgeon up there? Telesurgery may be the solution. So earlier this year, a remotely operated surgical robot called Space Mira, launched by SpaceX, completed its first simulated surgical procedure at the ISS, while being controlled by 6 surgeons on Earth at the Virtual Incision Company headquarters. Their mission is to assess the impact of zero gravity while performing simulated surgical tasks. Space Mira was selected for this important job as it is the first miniaturized robotic-assisted surgery device that is roughly 1,000 times lighter than existing technologies, so perfect for launching into space.